I'm Dr. Walt Jenkins, Program Director for the Department of Physical Therapy. Welcome everyone to this evening's event, the White Coat Ceremony. Please have a seat. I want to welcome all the families, significant others, faculty, administrators, and most especially the D.P.T class of 2028 for the White Coat Ceremony. I'll be the MC for this evening. We have a number of speakers. Our first speaker is Dr. Edward Halpern, MD, Chancellor, Chief Executive Officer for New York Medical Center. He is not able to attend this evening, but he does have a video message.
Hello, this is Dr. Edward Halpern. I'm sorry I cannot join you in person. I'm on another part of campus right now, hosting a symposium on how medicine first encountered HIV in the early 1980s, and I can't be two places at once. I do want to share some thoughts with you on the occasion of your White Coat Day ceremony, and I will do so by telling you about 3 patients I recently saw in my capacity as a pediatric radiation oncologist, a physician who takes care of children with cancer. This child, as you can see, has a normal appearing left kidney with clear outlines, the tip of the spleen on the left, air in the bowel here, the liver is here, but there is a destructive mass which has enlarged the right kidney, disrupted the parenchyma of the kidney, and this is primary renal cell carcinoma in a child. The next patient is a 4-year-old whose grandmother saw a polypoid mass extending from the vagina while changing the child's clothes. You can see the mass on this cross-sectional imaging where the polypoid mass fills the vagina and presses the bladder anteriorly and superiorly and presses the uterus anteriorly and superiorly. Excisional biopsy showed a grape-like cluster mass. This is sarcoma botryoides, rhabdomyosarcoma of the vagina, a primary malignancy of childhood. The third case is a teenager with a large mass superior to the prostate and impinging upon the sacrum, causing pain from entrapment of the nerves coming from the sacrum. This is metastatic rhabdomyosarcoma of the prostate, a primary malignancy of the prostate in childhood. These cases raise fundamental questions common to pediatric cancer care. Why did this child get cancer in a scientific sense? And what are we going to do about it? And why did this child get cancer in a theological or philosophical sense? And what are we going to do about it? What causes cancer in a scientific sense? Well, there are the classic 5 forms of carcinogenesis. Some arise by spontaneous mutations. Some are the result of chemical exposures. Some are the result of hormonal exposures. Some are the result of exposure to viruses. And some are the results of exposure to radiation. Overwhelmingly, in children, these cancers are the result of spontaneous mutations without an exogenous cause. That is in contrast to adults. Adults usually get cancer of places where their bodies meet the environment. Children almost always don't. That is the important distinction. In the classic and oft-cited study in adults, the causes of cancer, quantitative estimates of avoidable risk of cancer in the United States by Dahl and Pito, they observe that you can explain over half of cancer in adults by use of tobacco and by excessive weight. Other forms of cancer in adults are the result of unsafe sexual practices for viral transmission of oncogenic viruses, occupational exposure, alcohol use, or excessive sunlight exposure. In some cancers, for example, adult lung cancer, They are overwhelmingly caused by lifestyle habits. You can explain about 4/5 of lung and then some by asbestos exposure or environmental radon. Carcinoma of the head and neck is explicable in most people by exposure to alcohol, smoking, or betel nut chewing. And if a person has more than one of these habits, as shown by the Venn diagram, then the risk of cancer of the head and neck goes up enormously. But children don't smoke. Children don't drink. Children are not alcoholic. Why do children get cancer? They don't get cancer from the places where their bodies meet the environment, whereas adults do. What are we going to do about these three cancers in children? I'm going to irradiate to relieve pain, ameliorate suffering, and stabilize the patient. In the case of the young man with the metastatic cancer in front of the sacrum, I'm going to give enough radiotherapy to stabilize him until he can be entered onto a clinical trial for systemic therapy. In children, one has to be mindful of the effects of radiation on growth and development. For example, in irradiating this cancer of the prostate in a child, the radiation beam clearly goes through the femoral necks, the bones of the pelvis, and there is exposure of the rectum and bladder to radiation. Irradiating children or giving them chemotherapy has long-term adverse effects. This was made clear by George Perthes in 1903 in this brilliant study where he irradiated baby chicks and let them grow up to become chickens. And you can see that if you irradiated the right wing of the chick when it grew up to be an adult chicken, there was arrested growth of the right wing compared to the left. Similarly, if you irradiate the femurs of rat pups, when the pups grow up, the unirradiated femur is longer and less bowed than the irradiated femur, or of the same thing for the tibia. So one has to worry about the long-term adverse effects of cancer treatment in children. Thus, in children, you are trying to balance the potential for cure and palliation against the risk of adverse effects. Now we must grapple with two other questions. Why do children get cancer in the theological or philosophical sense, and what are we going to do about that? This problem was formulated by the Greek philosopher Epicurus. It is called the Epicurean paradox. It was also formulated by the novelist Albert Camus in his novel The Plague. In both cases, the Epicurean paradox, or in the words of Dr. Ryu, a character in the novel The Plague, I refuse to believe in a God who permits the suffering of children. If one believes in an all-powerful, all-knowing, all-merciful God who rules the universe, then why does evil befall the innocent? Why do children get cancer? Why do children have to suffer the late effects of cancer treatment? They didn't do anything wrong. Why are they being punished? Is it that God is not all-powerful, not all-merciful, not all-knowing, or not all that interested? This is the Epicurean paradox. Such behaviors, Epicurus says, are not characteristic of God. Why, you cry out to the heavens, do bad things befall the innocent? If you cry out to the heavens, the response will be silence. Thus, the philosopher theologian Joseph Soloveitchik responds that the only sensible response to the problem of evil in a theological or philosophical sense is action. You can cry out to the heavens and get no response, or you can try to do something about evil, including cancer in children. I would be the greatest chancellor in the world if I could solve the problem of evil for you in a few simple sentences. I cannot. The book of Job didn't solve it. The writings of the Old and New Testament didn't solve it. Philosophers have grappled with the problem of evil for at least 4,000 years and have not solved it. I can, however, recommend to you, as budding physical therapists, that you can respond to evil by action rather than philosophical musings about its cause. Why choose to be a physical therapist? You choose to be a physical therapist in response to the things like the causes of cancer or the problem of evil, because you are interested in the generation, conservation, and dissemination of knowledge about the causes, prevention, and treatment of human disease and disability, because that you believe that the practical application of the scientific method and a caring nature can be used to relieve pain, ameliorate suffering, and help people avoid, to the extent possible, premature death. Each of you, of course, will have your own reasons and will have to face issues that confront you during your clinical education. For example, the growing problem of illness among the poor and the marginalized of society, disproportionately affected by disease. Poverty is a carcinogen. Poverty is a diabetogenic agent. Poverty contributes to heart disease. Poverty is a contributor to traumatic injury. This will form part of your practice and will be part both of your clinical practice and of you grappling with the problem of evil. But to grapple is a noble activity, and becoming is superior to being. And thus, may I welcome you to that long line of people in white coats, stretching backward and forward in time, who've chosen to devote their lives to the relief of pain, the amelioration of suffering, and to helping people avoid, to the extent possible, premature death. I wish you Godspeed on this next part of your journey. Thank you for listening.
Greetings and congratulations. This is Dean Ambler here off campus, and like you, very shortly, I'm in white coat because when I see patients like you will, this iconic white stands for clean, it stands for service, it stands for honesty and trust. It tells your patient they can trust you. It tells them you can trust me. I came to work for you today. I trained for this for years, and here I am. We're ready to go. It reminds me personally that it's my job, but it's not just my job. It's my career, but it's not just my career. It's really my calling, at least for me. And I'm here to welcome you to this noble profession. Join me as a noble practitioner of healthcare, clad in white to show your commitment to our profession. And congratulations to you and your proud family and loved ones. Have a great career and enjoy your calling. Thank you.
Our next speaker is Dr. Vikas Grover. He's my superior, somebody I've come to rely on in our program and in our department. He's going to have a few words of wisdom for you. He's our department chair for rehabilitation sciences.
Good evening, and thank you for joining us in celebrating this wonderful evening. I was told that the white coat ceremony starts at 5:30 and ends at 7 p.m. today, and I don't think that is true. So we'll see. Neil Walsh had said a wonderful sentence there that, life begins at the end of your comfort zone. If we adapt it to the white coat ceremony, let's say white coat begins at the end of your comfort zone, okay? So the question is, did the white coat ceremony really begin today at 5:30 p.m.? I think it began much earlier than today. I think that's what Dr. Jenkins blocking my vision. So you stepped out of your comfort zone when you decided to choose physical therapy as your career. When you came to the first class feeling a little uncomfortable, yet excited for your new journey. When you decided to choose, when you realized you might need to redesign your learning patterns coming from undergrad now to grad school, things are different. You stepped out of your comfort zone. You stepped out of your comfort zone when you sat in the class and thought, oh, this is difficult. I don't know how I'll make it. When you started working with patients who were in pain and discomfort, even when the patients were your classmates who were pretending to be patients and doing those activities in your learning, right? When you studied for hours and hours on weekends, sacrificing your weekend fun. Sometimes I see students sitting here till like 8:30, 9 o'clock in classrooms and writing your notes, stepping out of comfort zone. Socrates had once said, we were taught to memorize answers, but not to question questions. The real journey of white coat started when you began questioning questions and using critical thinking. And that happened every day in your every single class that you were a part of, or activities or labs. So we all know, what does the white coat generally symbolize? Professionalism, responsibility, and commitment. But I want to bring your attention to some building blocks. The first one I want to emphasize is humanness. We know what humanness is, but you started thinking when you started taking your courses, you said, the state of being a human. I am a human, but the person who I am going to provide services to is a human. They share the same feelings, they share the same understanding, they share the same expression. Let me listen to them. But how can we express that state of being a human? By using compassion, which means the root is to suffer with, or fellow feeling. Suffer with, don't get it wrong, you're not suffering with, like in suffering, but you are understanding that suffering from somebody else's perspective. And that's huge. That means you have to inhibit your own feelings and activate that listening towards others. That's what it means to be saying, fellow feeling. Only then you can go to the third foundational principle, that is service. The act of serving or helping. You cannot show the act of helping or serving if you don't show compassion and listening and understanding, right? So as in all the classes that I teach, I have an activity for you guys, only for the class who is getting the white coat, so be ready. There are no grades, no remediation especially. You don't have to remediate, and the exercise is on my next slide. You have these 6 circles: service, diagnosis, compassion, therapy, listening, and humanness. This is a knowledge check. Arrange them in the right sequence. Quick. Anyone? Either you raise your hand and to volunteer, or I call names. No, I'm not going to call. You can volunteer. You get my point there, right? We don't have to answer this, but you get my point. Somebody can say, oh, compassion, but somebody can say humanness, and then compassion, then service, then diagnosis, then therapy. It all is a great combination that you will be using throughout your careers. And that all started when you started stepping out of your comfort zone. It's not easy. It's not comfortable. So, white coat ceremony. Will it be okay if I say this? Yeah. It started a long time ago and is going to be a lifelong process. This white coat is not just going to happen tonight and forget about it. It's going to keep happening every time you are in that mode of providing services, right? This is just the time to remind ourselves of the path we are already on. So congratulations, and a great day to celebrate, and enjoy your white coat ceremony. Thank you.
Thank you very much, Dr. Grover. Excellent words of wisdom. Our next speaker is Dr. Nick Sheehan, professor in the Department of Physical Therapy. Dr. Sheehan is going to give the faculty address.
Thank you very much for the introduction. I'm truly honored to stand before you today and share this meaningful moment as one of your faculty members. First and foremost, congratulations to the class of 2028. It is your hard work, discipline, and dedication that has brought you here today. These same qualities will continue to serve as the foundation for growth throughout the remainder of your academic and future clinical careers. At this time in your academic journey, you may have noticed that there's a palpable shift in mindset. You're likely to beginning to exhale after completing rigorous foundational coursework. However, you are preparing to start your next chapter, clinical education. Through my experiences working alongside leaders in neurorehabilitation, while prepping for clinical specialization, and while even working with all of you, I've recognized that the framework for thought that you are developing here aligns with some of the best in our field. I share this because at this stage, your perspective still may be limited. You may feel anxious about completing your final exams, Neuro 1, written exam Monday morning, okay? Or even entering the clinic and treating patients. But I do want to reassure you that if you continue to critically think, you are already on the path of achieving meaningful outcomes for both your patients and yourselves. In this profession, you will meet people during some of their most challenging moments of their lives. After a life-altering neurological event, someone that's going through persistent pain and dysfunction, or even following injuries that just change the course of their own identity. It's those moments that you'll be more than a physical therapist, you will be a cornerstone of their support system. Patients will look to you not only for treatment, but for guidance, reassurance, and inspiration. They will see you as a model of both physical and mental resilience. At times, it might be difficult to see the bigger picture. It's easy to get lost in the long hours of studying, analyzing cases, completing assignments, and refining your hands-on skills, but all of it serves a greater purpose. You will play a role in countless recovery journeys, and sometimes in ways you may never even realize. The white coats you will be donning here today reflects commitment to professionalism, ethical responsibility, evidence-based care, while also reminding you of the trust patients will place in you during some of their most vulnerable moments. As you put on this coat, you step into a role that requires not only knowledge and skill, but compassion, accountability, and humility. It is both a privilege and responsibility, and it signifies the beginning of a lifelong journey of growth and service to others. You are the future of this profession, and with that comes the responsibility to uphold and advance the standards of care, compassion, and excellence that define the field of physical therapy. So as you don these white coats momentarily, I would like you to consider the following. Always value education and knowledge. See every experience as an opportunity to learn. Stay curious. Set goals and actively pursue them. Understand that meaningful growth rarely comes easily, but it's always worth the effort. Search for your passion. Find what excites you within this field. Let that passion drive your work. When your patients see your enthusiasm, it will inspire their engagement and motivation just as much as your own. Hold yourself to a high standard. Expect more from yourself and from your patients. Don't shy away from challenges that seem out of reach. You may be surprised by what you are capable of achieving. Always ask why. Why are you choosing this particular intervention? Why is your patient progressing or not progressing? Why has the patient come to you? And most importantly, why did you choose to become a physical therapist? The question of why will push you to think critically, deepen your understanding, and keep you grounded during the most difficult times. And finally, as already mentioned, be humane. In many cases, a patient's chart will introduce them before you ever meet, but do not let it define them. Take the time to understand who they are beyond their diagnosis, their values, their motivations, and their story. I can say with confidence, you have what it takes to become exceptional clinicians. The journey will not always be easy. There will be challenges and setbacks, but if you remain connected to your values, your purpose, and your patients, you will continue to grow. Strive for excellence, pursue your fullest potential, and remember the responsibility and privilege that comes with the white coat you received today. Thank you again, and once again, congratulations to the class of 2028.
Thank you very much for those great words, Dr. Sheehan. It's my pleasure to announce our alumni speaker, Dr. Peter Kalikia. He is a 2025 New York Medical College graduate whose passion for physical therapy began with his own struggles with serious back pain years ago. He is a co-founder of PFP, Strength and Conditioning, which became performance-focused physical therapy upon graduation. His practice works on integration with precise physical therapy practice, advanced strength and conditioning principles, and he utilizes an individualized attention, detailed movement analysis, and thoughtful treatment design to reach his patients and clients. Dr. Peter Kalikia.
Thank you for that introduction, Dr. Jenkins. Before I begin, I do want to express my sincerest gratitude and humility for being asked to speak as the alumni representative this year, just 1 year removed from graduating New York Medical College. It's truly an honor and a testament to what my former professors and now colleagues think of me. So with a humble heart, I say thank you. Congratulations to the class of 2028. Give it up, all. 3 years ago, I was sitting exactly where you all are now, relieved to have made it this far, even if you may still have a few exams left, right, Dr. Sheehan? Okay. And immensely excited for the journey ahead. Don't underestimate the significance of this moment. Take it in, appreciate it. You've worked hard to get here, and this milestone represents your readiness to begin the clinical phase of your education. They say experience is the best teacher, and during your clinical rotations, you will finally take everything you've spent the past semesters learning and apply it in real time with real people in front of you. And unlike paper cases or practicing on classmates, patients are variable, complex, and not always straightforward. That is what makes problem solving and clinical decision making so essential. Understand this: you will face uncertainty, insecurity, and confusion. You won't have all the answers. You're not supposed to. I still don't. That uncertainty is part of the refining process. Just like how gold and silver are refined in the discomfort of burning flames within a fire, these moments will sharpen you and accelerate your growth exponentially between now and graduation. It will take profuse repetition, mundane consistency, and time, but the end result will be worth it. Now, my clinical rotations were instrumental in my own growth. My first one was in acute rehab at Stanford Hospital. Now, I'm an ortho guy through and through, so my first thought was, I get my hospital requirement out of the way immediately. I'll take that in a heartbeat. But little did I know, this became one of my favorite and most impactful clinical experiences I had. I was blessed to be able to build relationships with people at their lowest points and be the rock for them when they needed it the most. Fitting because my name does mean rock in Greek. And at a time where I began rekindling my faith in God, this clinical could not have come at a better time. I still remember my patients, their names, their faces, their stories. I remember firemen carrying a patient with my CI while facilitating and blocking her knee to help her walk, helping another patient recover from a CVA, and later receiving a book she had written before her stroke, and she signed it just for me. And even playing guitar for a patient who had suffered a stroke just as she was on a journey of learning to play herself. Sometimes you do take for granted how much of an impact you can really have on someone's life in this profession. On my last day, I had one patient tell me through tears in his eyes that he saw me as a son. Another one said, "You can't leave yet. I'm not ready to go home. I don't know what I'll do without you." And another crying her eyes out, saying in slurred speech, "I'm going to miss you. When I can walk on my own again, I want to dance with you." My CI and all the nurses had to leave the room as I comforted her because it was that emotional of a moment. What a first introduction to the profession I love and call my purpose in life. My third clinical rotation fostered my growth not only as a clinician, but as a future PT practice owner. My CI was the main owner of the PT practice, so the business mentorship I received, combined with the exposure of integrating strength conditioning with physical therapy and working with athletes, gave me the vision of what I wanted to build for my own PT practice. I still talk to him today to get his advice and guidance. In my fourth clinical, I was able to refine my hands-on skills, learning from IPA certified instructors while learning to view the body through multiple lenses, understanding not just the site of pain and local injury, but the system as a whole, and identifying the true limiting factors for more efficient outcomes. From my second clinical rotation onward, I had my own strength and conditioning company while I was in PT school. What I developed in that first clinical rotation, prioritizing the person and delivering quality care, became the foundational pillar of my professional career. And the business acumen, the clinical wisdom, the hands-on skills, the clinical decision-making developed in later clinicals gave me the confidence to take the leap and start my own PT practice with my business partner called Performance Focused Physical Therapy, officially launched literally last week, when most people may have cautioned against it. But the quality of my clinical rotations with the experience from my strength and conditioning company prepared me well for my new PT practice. Skill can be taught and will develop over time and with practice, and yours will too as you continue on your journey toward graduation. But integrity, character, and love for the person in front of you can't be taught. That comes from within. No matter where you are placed with your first clinical, you have the ability to treat each person like they are the most important individual in the room. That interpersonal and genuine relationship you develop with someone builds trust, and that trust enables that patient to be comfortable with you working with or practicing on them. It also shows to your CI that you care and you take initiative, and that opens the door for more responsibility, more opportunities, and more growth. I'll leave you with this. We will all obtain the requisite knowledge and skills to help people, and will continue to develop them as we advance in our own professions as PTs. But if you cannot build and foster that genuine relationship between you and the patient, then the impact you're capable of making will always fall short. Even the best clinical skills will never reach their full potential. Our patients and clients should know and feel that we want the best for them. Because at the end of the day, in a world full of distractions, people do not care how much you know until they know how much you care. Thank you.
Thank you so much, Peter. Very inspiring words. It's great to see a young person start his own practice so early in his career. Thank you. Something to aspire to. At this point, we are going to don the white coats. I would like to ask the students the faculty to stand up one by one and come to the stage, starting with Dr. Catherine Curtis, Dr. Janet Delat, Dr. Parmveer Kaushal, Dr. Ainsley Rossi, Dr. Victor Santamaria, Dr. Nicholas Sheehan, and Dr. Christina Welsum. Students will be called up in groups of 7 by Miss Amanda Guzman, a member of the second year class.
Good evening, everyone. Welcome. Thank you so much for joining us today, this evening, to basically celebrate all your loved ones' hard work today. It's truly an honor to be able to be in this experience and call up your loved ones. I'm going to start off with calling off the second row. Can you please stand and go to the side where Fran is towards your left? So we'll start off with the wonderful Kayla Aqua. Nada Ali. Julia Anarumo. Shamir Ayu. John Balk. Alexa Beltre. Malcolm Bermudo. And now we are donning the white coats. Next, Sydney Boyer. Marcello Bushanich. Nicholas Dorico. Samuel Diaz. Dina Dorn. I could feel the energy, guys. Brendan Draper. And lastly, Madeline Feller. And we now will don the white coats. I'd like to now call up the third row to please stand. And please go to the side towards your left. Now, I'm going to be calling up Antonio Fernandez. Courtney Gallagher. Marissa Jean-Vier Desjardins. Anmol Preet Kaur. Chu-Wei Cool. Christopher Liz. And lastly, Isabella Manusesh. And now we'll don the white coats. And now we'll start off with Alexandra Maza Landy. Lucy McLaughlin. Amit Mulia. Juliana Mascati. Tristan Okamoto. Maria Aranatoli. And lastly, Alexandra Ortiz. We'll now don the white coats. And we'll start off first with Anthony Padilla. Bianca Palacios. Ariana Pfaffenberger, America Portillo Garcia, Alexandra Quinones, Deepa Remy, and lastly, Gabriel Santiago. And now we'll don the white coats. So. Good job. And now we'll call up Perry Chapman, Anna Schwegard, Jake Sidorsky, Kiana Stavish, Alexis Tinio, Felix Urena, and lastly, Harneet Valan. And now we will down the white coat. Congratulations, class of 2028. It has been a pleasure, and now to follow through is Dr. Jenkins.
As outlined by the other speakers in the white coat ceremony this evening, this really represents the end of your first year, but now you're going into the clinic for the first time. And that represents a big difference from where you've been. You've been in a group, you've been in your class, you've been protected by faculty, and now you're going to go out and you're going to be in a clinical situation, which is much different than what you have here. You're going to be with people that you don't know. You're going to be with people that may judge you a little bit differently than what you see with the people here in the room. There's going to be anxiety that you have. And everyone has anxiety. I remember the first time I went to a clinical rotation, my very first day, it was in a county hospital, and I was seeing patients that were very different from what I had been expecting. And I had a lot of anxiety there. It really was very difficult for me to work through that the first day, but I survived it, as all of you will. And I got through that first day, and things started to get easier. All of us have anxiety. All of us have that. Dr. Grover talked about that a little bit earlier and maybe a little bit different words, but all of us have that, okay? All of us are put in stressful situations. And on that first clinical rotation, you're going to be put into a stressful situation that is unique to you. I have a little thing that I think about when I'm going to be going into a stressful situation. And when I teach students about that, and it's three simple things: know what you know what you don't know, and be confident. If you can think of those three things, it will help you through that anxiety. Knowing what you know, relying on what the faculty has taught you. You can trust them. They're great people. They're very learned. They've practiced our profession for many years. They will not steer you wrong. Rely on that. Think back on what it is that they taught you this first year. That's knowing what you know. Knowing what you don't know. Be careful there. Don't reach out there and do things that you are uncomfortable with. You have a little intuition inside you. If you haven't been taught something, maybe I need to step back a bit. Peter talked about that earlier today. Think about that. How do you take care of that problem? Ask questions. Ask questions of those that are around you, your CI, the other people in the clinic. That will keep you out of trouble. Be careful treading on things that you don't know. Don't reach too far with that. And then the third thing is to be confident. In order to take care of patients, one must be confident. You can't have a patient, or excuse me, a therapist that approaches people that is not doing so in a confident way. You have to be confident in how you take care of patients. And that's a real key. Patients see that confidence in you and it helps them. So think about that. Clinicians who are confident have great results. Thank you. At this time, I'd like to thank individuals and groups within the audience. Thank everyone for attending this evening. First, an applause for the class of 2028. Please stand. Face your people. Class, please keep standing. Now applaud all those in the audience who helped you through this. Through your life up until this point, all those people that supported you through this year, all those people that supported you, and you know who they are. Thank you, everyone. I'd like to also have an applause for Dr. Halprin. Go ahead and sit down, class. Dr. Halprin. Dr. Amler. Dr. Grover. Dr. Caliclia. We also should applaud Francesca Menta. Where are you, Fran? Is Nick Stasiluke here? Well, let's applaud him anyway. And Amanda Guzman. We also need a big round of applause for the educational media team. Thank you. At this point, the ceremony is over, but I would like for all the students, all the dignitaries to come forward for a picture, and we will have Dr. Christina Welsum do the pledge. Thank you.
So all semester, gang, we've been talking about our values and our ethics. And now I would like the class to stand up Bring it on over. All right. In 2004, the House of Delegates of the American Physical Therapy Association resolved to support the use of a professional oath or pledge for students in accredited physical therapist education programs and for licensed physical therapists. This pledge serves to enhance the commitment of the physical therapist professional to the patient, the client, and to themselves. To the APTA Professional Vision 2020, to the Code of Ethics, the Guide for Professional Conduct, and Standards of Practice, which have set forth principles and guidance for professional behaviors, as well as the core values of the physical therapy profession of accountability, altruism, compassion, caring, excellence, integrity, professional duty, and social responsibility. At this time, I'm going to have each of our physical therapy students stand and recite this pledge. And I would also like to invite all physical therapists in attendance, family, friends, guests who are also physical therapists to join and stand with us as you reaffirm your commitment to the profession. Faculty's ready? You are going to repeat each line after me, okay? As I enter the profession of physical therapy to practice as a physical therapist, I solemnly and willingly pledge the following. I will respect the rights and dignity of all individuals and will provide compassionate care. I will be trustworthy towards my patients and clients and in all other aspects of physical therapy practice. I will place the welfare of my patients and clients above my own self-interest. I will provide accurate and relevant information to patients and clients about their care and to the public about physical therapy services. I will exercise sound judgment and comply with laws and regulations that govern physical therapy and protect the public from unethical, incompetent, and illegal acts. I will maintain professional competence and promote high standards for physical therapy practice, education, and research. I will address the health needs of society and strive to effect changes that benefit patients, clients, and the community. I will respect the rights, knowledge, and skills of colleagues and other healthcare professionals and seek consultation whenever the welfare of the patient or client may be advanced. Thus, with this pledge, I freely accept the responsibilities that accompany the practice of physical therapy. Excellent. You may be seated.
At this point, we've now concluded our evening. All the guests can leave. We would like pictures with all the faculty, students, and dignitaries up front. There will be additional pictures out in the lobby afterwards. So thank you for coming.